This video is an introduction to the peripheral nervous system. As with our previous video on the central nervous system, I will briefly discuss important concepts such as anatomy, function and pathology, which again are relevant to cases you may come across in underwriting or claims assessment. If you have not watched the video discussing the central nervous system, please do so first before continuing with this video, as important concepts relating to the nervous system are covered in that video. The peripheral nervous system consists of all the components of the nervous system outside of the brain and the spinal cord. The peripheral nervous system is a collection of nerves connecting muscles, skin, organs, glands, and body systems to the central nervous system. The peripheral nervous system is responsible for transmitting information to and from the central nervous system and contains the cranial nerves, spinal nerves, peripheral nerves, and neuromuscular junctions. Cranial and spinal nerves originate from the spinal cord. Cranial nerves supply the head and face, and spinal nerves the rest of the body. Peripheral nerves are branches of the cranial and spinal nerves. Dermatomes are skin regions that have a specific nerve supply, and myotomes are muscle regions with specific nerve supply as well. The peripheral nervous system can be divided into two further subcategories and functions: the autonomic nervous system and the somatic nervous system. The autonomic nervous system is involuntary. It is responsible for maintaining balance within the body systems. These functions occur automatically and are self-regulated. Nerve supply to the heart, smooth muscle, organs and glands inside the body are part of the autonomic nervous system. It is distributed throughout the central and peripheral nervous systems to allow for self-regulation. The autonomic nervous system is also further divided into two systems, the parasympathetic and sympathetic nervous system. The sympathetic nervous system triggers fight or flight reactions, and the parasympathetic nervous system has a calming effect. The autonomic system is always active, but moves between sympathetic or parasympathetic states. The somatic nervous system is voluntary and allows us to react continuously and actively to environmental stimuli. It includes a number of spinal and cranial nerves. The system controls movement of skeletal muscles. The peripheral nervous system has two types of nerve fibers, afferent and efferent fibers. Afferent peripheral nervous system fibers lead information to the central nervous system, whereas efferent fibers send impulses out of the central nervous system to the other body parts and areas such as muscles or glands. Nerve fibers are also classified into motor, sensory, somatic or visceral pathways. Some nerves can have mixed nerve fibers, such as sensory and motor nerve fibers. Motor nerves have only motor fibers, and sensory nerves have only sensory fibers, with the exception of a few. There are 12 pairs of cranial nerves and 31 pairs of spinal nerves. Of the 12 cranial nerves, 3 are motor nerves, 6 are mixed nerves, and 3 are sensory nerves. The cranial nerves supply motor and sensory function to the face and head and provide us with our 5 senses. The 31 pairs of spinal nerves are made up of 8 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 1 coccygeal. As mentioned in the previous central nervous video, the spinal cord terminates in the lumbar region. Where the spinal cord terminates, peripheral nerves fill the spinal canal. These peripheral nerves look like the tail of a horse, and hence the name cauda equina, a term you may have come across before as well. The different spinal regions allow for a distribution of nerve supply to different areas and organs of the body, and depending on where the abnormality or pathology present in terms of signs and symptoms, the clinician can identify which spinal nerve is involved. For example, the cervical spinal nerves innervate the arm. Should there be a weakness of the arm or paresthesia, pins and needles, the clinician would know to investigate the cervical nerves for pathology. So what can go wrong? The central nervous system is protected by the skull, vertebrae, and blood-brain barrier, whereas the peripheral nervous system is susceptible to trauma, toxins, and infections. Damage to or dysfunction of the neuron, this is the cell body, myelin sheath and axons, or muscles or neuromuscular junction, can result in a disorder or condition. Disorders can be genetic or due to toxic, metabolic, traumatic, infectious, or inflammatory conditions. Peripheral neuropathies may affect one nerve, this is known as a mononeuropathy, multiple nerves diffusely, a polyneuropathy, or involve a plexus, a plexopathy, or the nerve root, which is a radiculopathy. Radiculopathy is a dysfunction of a nerve root. It usually affects the cervical and lumbosacral spinal nerves, and compression of the nerve root is a common cause of dysfunction. Symptoms are usually pins and needles, pain, or weakness of the limb or the muscles affected. Radiculopathy is usually permanent, chronic, or progressive unless there is therapeutic intervention. Peripheral neuropathy is a result of damage to peripheral nerves. It also presents with weakness, numbness, and pain, but is usually in the hands or feet. It can also affect other areas of your body. The most common cause is diabetes mellitus, which is metabolic in nature. Someone who has diabetes is at risk of developing a peripheral neuropathy as well as autonomic neuropathy, which affects the heart's ability to function properly. Diabetes-related neuropathies are chronic, and if the condition is not well controlled, it will progress and symptoms worsen. Autonomic neuropathy occurs when the nerves supplying the involuntary body functions are damaged. It can affect the heart rate, blood pressure, digestion, bladder control, and temperature control. This refers back to the autonomic system, as discussed previously. Autonomic neuropathies are usually chronic and irreversible, however, symptoms may be controlled with the use of medication. Because the peripheral nervous system is so complex, a thorough examination by a doctor is necessary to establish the cause and the nerve region affected. A neurological exam performed by a neurologist must always include evaluation of muscle and sensory function, along with comprehensive checkup of all body systems. Special investigations include blood tests, imaging studies, electromyograms, and nerve conduction studies.